Welcome, everybody, to the A Little Less Fear podcast. I'm your host for the show, Dr. Lino Martinez. Oh, yeah. Welcome back, everybody, to A Little Less Fear podcast. Today, I'd like to introduce our guest, Dr. Anjani Mahabashya. She's a physician advisor and volunteer program director at a nonprofit. Welcome to A Little Less Fear podcast, Dr. Mahabashya.
Hello, everyone, and thank you so much, Dr. Martinez, for having me on today. And your story is no less inspirational. Thank you so much for being vulnerable and, starting this whole journey for everybody to feel that, they're not alone. That is the most important thing. You don't feel alone. You feel you belong somewhere. You're validated, you're supported. So thanks so much for everything you do.
Absolutely. And I do this all for all of you, for everybody listening and for all the guests, and to just keep motivating people. Thanks so much for being on my podcast. And I'd like to know your journey. What brought you to where you are today? I think it's incredible that you're a volunteer program director helping senior citizens. Why don't you tell us a little bit about your volunteer work?
About my volunteer work. So there was a background, how I got into the volunteer work to begin with. And through my story, our listeners are going to get like 3 takeaway points, I would say. Okay. The first one is hope, not to lose hope, even when everything in your life seems to be falling apart. The second one is networking. How do you build yourself back again? Right. And the third one is empathy. What do you give back to your community when your cup is full? How do you give back what you got as a gift? So those are the 3 things that will beautifully evolve as we talk about what happened to me. How did I get into the volunteer program director position at Partners for Healthy Community? So I was an active physician. Now I am a physician advisor at Geisinger. I was an active physician taking care of seriously sick patients, 12-hour shifts on my feet all the time. And I had a terrible fall at my workplace, and I thought I would recover, fast. And more so, I was like, I'll get a discount. I'm a doctor, I know how to take care of things. Didn't happen that way at all. I had a really bad injury on my left leg, didn't heal well, got into a consequential injury on my right leg. The healing process was quite prolonged. In the meantime, I lost my job, and that was the COVID year, 2020.
Oh, wow, that's tough.
Staying in my house.
One thing after another.
One thing after another. It was a COVID year. I was stuck in my apartment for almost a year, nobody to help, nobody to talk to, just dealing with everything myself. And that was the first time I realized that, how complex healthcare system could be for somebody who's working in healthcare, right? So it was a aha moment. I'm like, oh my God, this is so tough, because I also was dealing with all the disability paperwork or short-term disability, and how do I protect my healthcare insurance while I'm told that I'm let go. Then I had to use up my PTOs to have some status, and it was very, very tough journey. And I just had to gather courage and approach a medical director at our system. And I asked him for a role for which I had no experience. And he had that empathy to listen to what I was going through. I was still a physician, and later I went back and asked him, what made you take me when I said I had no experience? He said, there was enthusiasm in your voice, and I knew I could train you for this role. And I got into this role, and that was my first step to, again, building myself back. So that's where, networking is very important, where you reach out, you build that ecosystem from the beginning, because I did not do that, however, I had that courage to just go knock on any door, sure. Hey, I need some help, I want to be given some role, some job to have the dignity of all the education I went through, right? For years I studied, and I'm you just, I couldn't wash off, no, I'm not a doctor anymore. It was a total emotional burden as well that I couldn't take. So that's where I say don't lose hope. Sometimes you might not have anybody that is like, actually able to relate to what you might be going through. However, you know what you're going through. Never lose sight of who you are, and then have that hope, network, and be sincere to your work. And everything was going well at that point. It took me about 2 years to settle down in that role and, do really well in the role. And unexpectedly, a door opened where I had an opportunity to volunteer with a nonprofit organization. I actually got an opportunity, like I was asked to donate, and I just went and looked at the website. I'm like, okay, I will donate, but what is this about? And when I
Were you
went,
curious right away as far as how you could be involved, or that wasn't even in your head yet?
it wasn't in my head yet. Like,
Okay.
when the founder, who was another provider in my system, asked me to donate, and we didn't know each other. It's a huge system. So he asked me to, like, he sent me a LinkedIn message, hey, can you donate? I was like, yeah, sure. Like, it's like $50, $100, didn't matter.
Yeah.
But when I went into the website, it was like an aha moment for me, because I realized that this particular nonprofit was teaching our senior citizens and community how to use technology. And just a couple of weeks ago, one of my friends mentions to me that many of his patients don't show up for televisits. And I'm
Oh,
like, oh
wow.
my God, how would they show up? They probably have no idea. Now
Right.
I'll
Oh,
try.
wow.
Yeah, like they have no
Yeah,
idea
because
how
of,
to
yeah, I
do
mean,
it.
who's teaching them? Who's even showing them how to do that?
Them. Yeah, like, yeah, there is an epic line, or there are some customer service, but even to call that, it's difficult for senior citizens
It
to
is.
and then navigate. A simple analogy is, at a checkout in grocery store, we have a self checkout option, but we also have a human body who checks us out.
Yeah,
People who are like at different levels
it's
of,
a different generation. I mean, we
it's a
can't
different
expect them to just all of a
generation.
sudden be
Yeah.
telepathic and know how to use everything so readily and so fast.
Exactly. For us, it's like it was a little bump in the road. It was like we always use technology. For them, everything was such a fast pace, let it be healthcare or calling a ride, like taxis being replaced by Uber, like
Oh,
restaurants are closed, everything
yeah.
is takeout. Every single thing was an issue, and they didn't have like a basic education of how to do it. And
Oh,
I
that's heartbreaking.
yeah, it is. And I just asked him, I will donate money. However, can I just come volunteer? And he said, come over. And when I went there the first day, Dr. Martinez, I kid you not, like I met Susie. She had a iPhone, and she didn't know how to take the call on the iPhone. She was constantly
Oh,
canceling the call. And I sat down with her, and she said, my grandson is going to college, I want to see him. And
oh,
we called Chris, and we saw him on FaceTime, and her face lights up, like she's so happy. She is now calling Chris all the time.
that right there is just warms up my heart right there.
Oh, and then the next time I went to see Susie, she was watching YouTube, and she was watching Hazard, the two cello player on YouTube. And she tells me, Dr. M, you know what? I have a massive crush on Hazard. And I'm like, what can I say? So they're so beautiful. Like each senior citizen has a story behind them. They have a loved one whom they want to see, whether it is their grandchildren, their friend. And we have had senior citizens who have connected to their friends who then did not speak for like 10 years, 20 years. We
Oh,
found them
wow.
on Google Duo, and we
That's
just
so
connected
awesome.
them. Yeah. And emails, and YouTube, like let it be their church community, or most importantly, their healthcare. And I have had senior citizens who tell me that they have to stay on the phone call for 30 minutes to order or refill a medication.
Oh, no.
Yeah, now let's imagine, they are not able to do that, and they miss the medication. There are consequences. It's a chain of events that leads them to the emergency room and
Oh,
increases the healthcare costs, and
right.
increases their suffering and the family suffering. One person affects a lot of people, and and one person can change the life of one person too. So
Yes.
Yeah. So, and that half an hour that they're able to just go into their Epic or whichever, system, we don't do it only for our Geisinger patients. It's a nonprofit, which is completely separate from my workplace. And it doesn't matter which system you go to, we're there to just help you out. And like, boom, one click, they have their medications ordered. Now, what are they doing with their 30 minutes of time? We help them with vertical gardening. They garden, they grow plants, they grow tomatoes, beautiful sunflower plants, and so and they're so happy. And we all know, I know, loneliness,
Yeah.
depression, all these things affect the mortality and morbidity of every single disease.
Oh
uh,
yeah.
it just doesn't let you take care of yourself. You're losing
Right.
interest. You don't want to take care of your medical illnesses, whether it is diabetes or thyroid or any other disease. And once you take care of that part, you take care of your mind, you feel that belonging,
Yeah, you feel more alive.
you feel more alive. And we 40 senior citizens 40 senior
Wow.
citizens have been quoted so far. And the most beautiful thing is some of our senior citizens are now taking up the volunteer role because they see how
Nice.
happy they are and they're ready to travel to the next building that we're going to take up.
Wow.
Yeah, to teach other senior citizens like them how to use technology. And this is the ripple effect we were able to create with empathy. So I am so excited that, like healthcare is a spectrum. Like we have our home, our community, your primary care doctor and hospital. How
Mm-hmm.
do we, like, contribute to each block of this spectrum as a human being? And you
Right.
don't have to be a doctor, anybody can teach that senior citizen or anybody who doesn't know technology. Like, so I really request everybody who is listening today, it only takes about an hour or two in a month
Yeah,
or
right.
in 2 months. Find somebody who might need some skill, and if you teach that skill, you will make them independent in some walk of their life. And I kid you not, it will come back as a blessing for you in some shape or form. And I have had so many blessings. I mean, there was a time I couldn't stand on my feet, Dr. Martinez. I was on crutches. To now, there are a village of people, both men and women, who are literally, coming to my rescue and, making sure that I get to do these great things. So I really want people to have that empathy to, just go out and help, and it'll create a ripple effect and you will get back 100 times more from the universe.
Oh, I agree. I mean, the amount of karma that you're building, I mean, naturally, because of your incredible, beautiful heart that you have. I mean, it's coming back 20, 30, 40, 50 fold. That's amazing. And I love the elderly. About 12 years ago, I used to be a program director at an adult day healthcare center. And I loved people that were my seniors. I
Yes.
mean, there was so much love. Obviously, there were some that were grumpy, but rightfully so. They had hard lives. They were losing their memory. They had a stroke. I mean, they were feeling lonely. Of course, you're going to be grumpy.
Yes.
And but I mean, all they need is love. Really, it's just a little more love, and it does get lonely for them. Their kids are out. They're married. They've got their own life now, and it's like that's why there's memory loss too. It's like, well, you're not working that part of your brain, and then technology is just going so fast these days, and everything is developing at a faster rate than ever before. How do you keep up when you're slowing down? So
Yes.
it's
Yes.
really beautiful that somebody with your spirit is coming around to lift up our senior citizen population. We definitely need more of you.
Yes. And to give love, yeah, you're giving them love, or you're teaching them technology. However, Dr. Martinez, I think they gave us more love than anything else. So here's something I want to add. There are a lot of like us youth or anybody who is feeling that, you don't belong. Just pick up something like this. The kind of love they give you, it's the same thing. Affection is same. It doesn't have to like really come from a particular person or a particular age or anything like that. They were so welcoming to all of us. I had a coughing spell and three senior citizens literally ran in different directions to just get me a bottle of water. And like
Oh, how lovely! I love it.
like, yeah. And then like one day, like there was a storm or something like that, and they were like, "Oh, Dr. M, let's check the weather." Everybody's checking the weather there, I'm like, except me, everybody's checking the weather to make sure I was fine going back home. So they really care for you. Their eyes light up, whenever I go there. And there is nothing like, somebody is waiting to see you, like that's a very beautiful feeling. I want people to experience that. A lot of times we feel that, I have nobody, there's, but why feel that way? Find
Right.
people, you feel that you're giving them something, but, if you like really shift your mind, you're actually getting a lot more. So
Oh, yes,
that's what it
definitely.
is. So
Why do you think that the elderly population have so much more love to give than, I guess, younger people?
I think they have seen a lot, they have really like, seen life in so many years, like they've gone through the highs and lows, and they know what you're going through. They're very
Yeah,
accepting, they're not judgmental. So
right,
they don't judge you. They don't like, they know what you're going through. They have that empathy. So that's why they're able to give love. They're not selfish. They're not like, me first. So I think all these factors where they've slowed down. So I think you don't have to age to have all these things. Once you slow down, you're
mm,
actually living in that moment, and
yes,
then you understand what is the meaning of life, how
right,
fulfilling it is. So that is, I think that's why, like they when even without us telling anything, just with our body language, or maybe when I don't have a good smile on my face, they know probably I'm stressed out about something else, and they
right,
are cracking jokes, and they are taking me to show the sunflowers outside and stuff. So yeah,
right.
I think very giving, because they don't have all these layers that we add when you're growing up. Kids and elderly, I think like they're very transparent. So transparency,
Mm.
good communication, heart to heart, meaningful, all those things are something that make them give love. So that's my take.
So it seems like after your injury, it was actually somewhat of a blessing because now you're in this new role and you're helping people beyond what you ever thought you would be doing before.
I never expected something like this. I never even expected that I would do at my work at Geisinger, I would do a role like this, like
Mhm.
because uh, everything happened all of a sudden. I had to pick up things that I would not usually, doing. And at my work, my role is I'm talking mostly to the insurance companies, and we're mainly focusing on value-based care at the hospital. Can we do this in the hospital, or can we do it with the doctor's office or an outpatient, and having that streamline of where the patients should be admitted, in which status they should be. So the way I tie this up to the nonprofit, in future, is
Yes,
I want both the healthcare systems and the insurance companies to realize that, investing in our communities is the goal. Like when you build
yes,
healthier community, automatically the healthcare costs would come down. How do you
exactly.
build healthcare communities is it's not easy, but nothing that was great was easy. So
Mhm.
building those and that's why I feel that, when I work, my work is all about value-based care, and the nonprofit is all about working on these social determinants of health. Do they have a transport? Are they able to do those doctor's appointments? How is their mental health doing? Are they happy? Are they able to order medications? All these, how is their housing? Do they have internet? Like we look into all these things.
Wow.
So having that like idea of all the spectrums, like I think I'm fortunate. I can't say I'm fortunate that I fell, but with that fall, I think I have looked at healthcare at a totally different, like from a totally different perspective, and
Yes.
I got a chance to see the full spectrum, right from hospital to community to primary care, you name it. Like I have seen it all, and I'm like, oh, not bad. If I'm like this young and I could see everything, I really feel blessed, and it's a blessing in disguise of what happened to me.
That's the way I see it. That's the way I feel it too. And so right now you're in the middle of building a second building for the senior citizen population.
Actually, it's our third. So
What? Oh my goodness.
Yes. So the first one was 2025 residents, the second one 2025 residents. So the second building, a few of our residents want to like come and help the third building residents how to like navigate and stuff. So we're kind of doing groundwork for the third building, make sure they have the internet and finding some maybe cost-effective internet providers or services, maybe to help them a little bit with the cost. And if they're unable to, then we have to look at some funding or fundraising event, something like that, but try to get that.
I just had this vision of you being like the CEO of like international senior citizens project. I just saw you being like on top of it. This is amazing. Do you have any thoughts or even just playful thoughts of expanding to other states?
Other states, we definitely want to increase within our community, and of course, yes, to other states. However, Dr. Martinez, like my life in the last 3 years, doors have opened for me unexpectedly, and I will see. Like I'm usually actually very planned to the dot, and that's how I was all my life, and I couldn't control anything in the last 3 years. That's how it's been, and we'll see what happens. That's what I can say. So
I live in Los Angeles County, and I'm certain that, I mean, I'm not sure if there's any type of facility that helps the elderly the way that you do, but I'm certain that that's definitely needed over here, especially in super busy cities. And with, I mean, I'll give you an example. My mother, she's not that old. I mean, she's about to be 72 next week, but there's little things that she can't navigate through Amazon, and sometimes I catch myself getting frustrated with her, but I have to come back and be like, hang on a minute, it's a whole other generation, like how can I expect her to just know how to order things on Amazon, and things that I take for granted, like groceries being able to be delivered, they still have to go in person and do all this stuff. And I'm like, wow, I have it a lot easier than she ever will and ever did. And I really need to step myself down and put myself in her shoes a little more, and realize that generation and older generations even, I mean, it's the patience is really what they teach us, and that's what where we need to start, with a lot of patience.
yes, and we are all aging. Something else might happen, like, or something new might come up when we get old. So anyway, so glad that you brought that point up. When we are working with the senior citizens, I think one of the things I've noticed with our young volunteers, like early 20s, is they start developing that patience. They look at aging as a very normal phenomenon, and they accept aging. They accept that, okay, it's okay that these things would happen to us. It's okay that you will fall sometimes. However, you will get up, and there will be like a lot more chances in life. So I have seen all of that in our volunteers who come and work with our senior citizens, where they are kind of like slowing down, and they become, it's like an instant like mind maturity that happens, and which is very good. They start performing well at their work, at their schools, because
Yeah,
they
I can
develop that
imagine.
patience. Yeah. And again, like in terms of other states, I would think that each of us could be a leader in our own shape or form. You could reach out to libraries or schools and ask them to arrange an event. Every school is capable of arranging an event where like they could ask the senior citizens in their communities to engage with the kids and teach them technology. Like the intergenerational bond would happen. They would like learn from each other. They would crack jokes. I'm telling you, I never got bored with these senior citizens. They're always cracking jokes, and
Yeah.
yeah, and they're so generous with their compliments, right? Like, they're always like, oh, Dr. M, you look so good today. But maybe, I will tell it to you quietly, because I don't want like this person to hear. She'll feel jealous that I'm complimenting only you. So so much like us, they're like us. So these are some of the ways, everybody can help.
Absolutely. Well, you're inspiring me. I'm feeling pumped up. Like I need to go reach out to different cities and see what's going on to volunteer. This is amazing.
Right. Thank you. Thank you so much.
So, yeah, what's something important you want the world to know? You think the world ought to know?
Yes. Thank you for that question, though. So with empathy, just by, pausing for a second, a minute, you're able to see the loneliness in somebody's eyes,
Yeah.
or how they're receiving you,
Right.
and just pause and make time. Again, having empathy is one thing, and taking action is the next step of empathy.
Mhm.
So take action. You don't have to always, do it immediately. You can always see where you could adjust, 1 or 2 hours in a month, and try to help somebody. Again, a lot of times, a lot of things block us from taking that action. Like, is it worth my time? Why do I waste my money on this, or things like
Mhm.
that? Or this person is probably going to take advantage of me. I think the
Yeah.
most important thing that makes life beautiful, and I learned it through my own hardships and everything,
Right.
Dr. Martinez, is empathy and learning how to have good boundaries
Yeah.
makes every relationship. So empathy builds
Yeah.
relationships between human beings, that deep connection.
Right.
And healthy boundaries maintain those relationships. So when you're
Right.
able to build those healthy boundaries, the empathy is never a problem. So we think that
True.
empathy is a problem because, oh, you're going to take advantage of me now, just because I'm helping you. No, empathy is not the problem. The
Right.
problem is we're not able to set that healthy boundaries.
That's
So
true, because if you have healthy boundaries in the first place, you wouldn't even be thinking that.
yes, exactly. So when we actually have these two things going, and that's what I want all of us to develop those skills. Maybe you will need a coach, maybe you have to go to therapy, whatever it is. Uh, Develop those two things, because when you know how to balance those two things, Dr. Martinez, you will 10x, 100x your education. Like that's what I feel happened to me.
Wow, what an amazing story. You're definitely, this is very inspirational. Thanks so much for being on my podcast. I really appreciate it.
Thank
So
you.
how can our viewers or watchers and our listeners find you if they need to message you, ask you any questions?
Sure, great. Anything in terms of physician advisor, which is my professional role, or how to probably coach the senior citizens. There, like sometimes tips and tricks how to coach them. Anything you need, you could reach me out on LinkedIn. I'm only on LinkedIn, so yeah.
Okay, yeah. What's your LinkedIn?
Anjani Mahabashya, just my first and last name.
Okay. Thanks so much for being on A Little Less Fear podcast. Thanks for sharing your empathy, your love, your patience, your light, your gratitude, and your blessings. You're definitely a blessing to this world. And I'm really happy that we got connected. And I hope we keep in touch. I'm sure we'll keep in touch.
I will keep in touch, Dr. Martinez. Thanks so much for having me, and bye, everyone.
Goodbye.
Thank you, everybody, for tuning in to A Little Less Fear podcast. For more information on my social media pages, you can visit me at www.alittlelessfear.com. I also have an incredible list of resources for people all over the world, and it's really formulated to help all kinds of people: LGBTQIA community, Alcoholics Anonymous, disabilities. The list goes on. So feel free to visit my website, alittlelessfear.com. You can also email me at alittlelessfear@gmail.com. I'm also on Patreon. I'm a life purpose counselor on Patreon. This is available for everybody, and it's also available for only exclusive members on Patreon. Everybody's welcome. So please visit me there at www.patreon.com/alittlelessfear. Thank you to all the new followers and subscribers. Go ahead and hit the follow, subscribe button if you haven't already, and tell your friends and family about A Little Less Fear podcast. Thanks so much for all your support. Love you all. Have a blessed day.